This is breaking news from the Las Vegas Review-Journal. Sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
First, I want to mention to you that as today in Clark County we have more than 234,000 cases of COVID reported and more than 4,000 deaths. Also, it's important to know that since early January we have experienced a sustained decline in the number of cases reported in the community, and also the testing positivity rate in Clark County has dropped dramatically. Actually, our positivity rate in late December was up to 22%. Today, that positivity rate is around 4.5%. So it means that today, 1 out of 20 people who are tested becomes positive from COVID. And if we compare to late December, early January, it was 1 out of 4 people who actually became positive of COVID. So what it means is that the disease transmission in Clark County has decreased, and it is not related to a decrease in the number of testing. That yes, we also are experiencing a decrease in the number of tests completed here in Clark County, but the positivity rate that is coming from our reports is consistently low. So that's very good news for us. In terms of the vaccination campaign, as you know, we started this campaign December 14 with the initial allocation of Pfizer vaccine. And after that, we received Moderna, was authorized by the FDA. And a few weeks ago, we received the Pfizer vaccine. So now we have 3 vaccines available in the community. Right now, we have administered more than 900,000 doses of vaccine in Clark County, and we are expecting to hit the 1 million doses administered before this weekend. So which is a great news, and we will very happy to declare on Monday that we already passed the 1 million mark in terms of vaccines administered in Clark County, and that has been a huge effort from all those participating in the campaign, as well as our community partners, and of course, our community members who have been coming to the vaccination site. I also want to mention that we, more than 624,000 people in Clark County have received at least 1 dose of vaccine. That's about 27% of our population. So in other words, 1 out of 4 people in Clark County already has at least 1 dose of vaccine. Also, we have administered a second dose or a Johnson & Johnson vaccine to more than 344,000 people. That represents about 15% of Clark County residents who today are fully immunized against COVID. Also, very important for us is that beginning next Monday, April 5th, all Nevadans aged 16 years old and over will be eligible for vaccination. And our registration system will be ready for that starting this Saturday afternoon. So it's important to remember that starting next week, April 5th, all adults in Clark County, 16 years and over, will be eligible for vaccination. I also want to mention that in April 7th, there will be a drive-through testing offer at Allegiant Stadium. That will be a one-day event that we are doing, supporting our testing effort. That even so, we are providing this vaccination across the county. We cannot forget that testing is very important if we want to decrease the transmission of COVID in our community. Uh, Also, in terms of COVID virus circulating here in Clark County, we have identified 26 individuals diagnosed with COVID who actually have been exposed to the UK variant, the B117. It's important to know that our lab, in coordination with the state lab up north, have a surveillance system that actually is consistently looking for variants of the disease. And this is a very strong coordination between the two labs that allows us to identify those variants. I will stop here, and then we will have questions. We have Chief Cassell here and Joanne available for most of your questions, and let's see if we can answer your questions today. And the ones that we cannot, we will get back to you. Thank you, Corey.
Thank you, Dr. Lian. Before we get to the questions, I just wanted to state we also have Dr. Court Loaf with us here today. He's our Director of Primary and Preventive Care. In case he wants to answer any questions, he is here also. Our first question today comes from Jacqueline Schultz from Fox 5.
Good afternoon, everyone. Is there any indication from the state how many doses we may get for the first week of the public rollout? And then there certainly have been plenty of appointments available at Southern Nevada Health District sites and also other public and private sites across the valley. There are some concerns from the top that those who really wanted the vaccine have kind of gotten it, and we're going to have a situation where we may have more vaccines than people. How do we reach that last mile who might be complacent or who might just not want it? And how is it crucial to reach that population?
Johan, Chief. Johan, you are mute. You're mute.
There we go. Thank you. So yes, we have seen a lower than average uptake on appointments this week. I would suggest that those who are eligible this week and those who need second doses to get in this week before we do have another surge next week. Keep in mind that the population of general population is a large population. It's a majority. So we have a lot of work yet to do, and we expect that there will be demand next week. So as the early adopters have received their vaccine and we're seeing a lower demand for vaccine, that is the work of public health, is to do outreach and go to individuals and with education and with decreasing barriers and increasing access to vaccines. So we tackle those problems one at a time and then work on getting the rest of the population vaccinated.
If anybody has any other questions today, please use the raise hand feature. And there we go. We've got one from Michael Scott Davidson.
Hi, Michael here. Quick question for you. So we were talking about the UK variant. First of all, point of clarification, and then a question all related to that. did you say that we knew of 26 people or Clark County residents who had tested positive for that at this point, or just been exposed, possibly exposed to it? And then the other question is, how big of an increase is that from this time last week? And are there any concerns about that gaining a large foothold here before we get a vast majority of our population or adult population vaccinated?
Sure, thank you, Michael. Yes, actually, those are 26 confirmed cases of this UK variant. So those are the cases that we have. Our lab received the specimens from all the cases, or most of the cases that we have here in Clark County, and whenever there is any indication that a specimen could be different from the original strains, our lab or other labs as well will submit those specimens to the lab up north, to the state lab. So that's the way that this surveillance system is designed, and that's how we are doing that. Of course, we have concerns about the spread of this variant, because it has happened in other territories. So and that's why it's so important for us to expedite the vaccination campaign as much as possible, in order to decrease the possibility of transmission of the virus in the community. The less transmission we have in the community, less possible is for the variant to establish itself here. So that's why the vaccination campaign is so important. Thank you.
Thank you, sir. Our next question today comes from Shannon Miller from Fox 5.
Hi, yes. Hi. My question is, sorry, let me stop the feedback one moment. Okay, sorry about that. My question is if we know what the allocation is for the week of April 5th, since we're going to be vaccinating so many more people. Has it increased from the past? Thank you.
Chief or Joanne, I think Shannon is asking about vaccine allocation for next week. I couldn't hear most of the stuff. I think that's what she's asking for.
Yeah, Joanne's trying to answer. She was muted. Go ahead, Joanne.
There we go. All right, sorry about that. Yes, we have not received word yet on the allocations for next week. We have put our orders in this morning, and they review those, and then we get those back sometime tomorrow. We are hoping for a large allotment, certainly to fulfill all the requests from our partners. So we do not have that information yet.
One second, please. Okay, next up, let's go back to Jacqueline.
Hi, everyone again. Wanted to ask, so in speaking with Dr. Loaf a couple weeks ago, we know that there was not going to be any plans for any massive sites. As we still see some minority communities lagging, what's the strategy to have more community and pop-up clinics?
So I'll handle that one. So we have strike team capabilities with some of our private ambulance companies. We've done outreach at many community centers across the. Oh, hello. Can you guys hear me?
Yeah, we do.
Yeah, so we've done a lot of community centers. We're still struggling. We have reached out with targeting certain groups of ethnicities by different media platforms, be it press conferences, print, and video, and Spanish also. So we're doing our best. I'm interested to see what our numbers come in as we tally up more of our operations at Cashman over the last week and a half, because I've been down there multiple times, and it's heavily Hispanic, which is great. We know that's a large percentage of our workforce, the hospitality group that we need to get vaccinated, and a part of the community that really was lagging behind some. Once our mass vaccination efforts start to dwindle off, we don't know when that's going to be. We anticipate being very busy for 3, 4, 5 weeks. But just as somebody mentioned earlier that we have a lot of openings available right now, that happens when tiers are still not, we're not adding any spots because tiers are still locked up. It happens every time. Whatever tier we were in, towards the end of that tier before the next one opened, we were slow. It was just the way it happened. So next week we'll be very busy, and we anticipate that lasting for weeks. Once we start to see a downward trend in that, we will discuss our operations and look at how we can maybe reduce some of our mass vaccination sites down to maybe just one or maybe components thereof, and then re-engage in some more strike team focused activities with the people that we have on staff. We're trying to hire through contracts right now with the Office of Emergency Management and the state and the health district, different vendors to come in and provide vaccinations and extra staffing. However, since this is not a regional issue, this is a national issue, those resources that are usually available for sudden events such as storms and terror strikes and things like that, they're not eligible because they're tied up elsewhere. So we're struggling with some staffing, but we will continue to make efforts to reach those and the homebound community.
And some other strategies too is working through faith-based organizations, places where families go to, those families would have contact with. So churches, their employers, we're working heavily with the hospitality industry to provide vaccines on site. And so those are some of the strategies that we would use to reach out to those populations.
Okay, we're going to circle back to Michael for another question.
Thank you for taking a second one from me. Two questions about the vaccination efforts heading into next week. The first for Chief Castle, and then one for perhaps he can also answer this one as well. First question would be, we talked about the earlier this week the MGM site that's opening up for on-site vaccinations for hospitality workers. I'm wondering at this point, I know it's a very fluid situation. At this point, have any more of the plans that have been submitted been approved and finalized that you can announce? They'll be launching, next week or in the near future that you could announce at this point. And the second question would be for moving into these larger groups. I'm just wondering if we're going to, at our mass vaccination sites, see an expansion of hours going later into the day, in the near future, and how late they might be going.
So on the first question, I can tell you that Red Rock Resorts and the Sands have both completed their process and will be coming online with vaccination efforts for their employees beginning first part of next week, which is excellent. And so has Caesars Palace. Caesars Palace, I believe, is starting on Thursday of this week. They've partnered up with a private entity to take care of their vaccine efforts. So we're making good progress with our big operators on the Strip and throughout the community. We have spoke with the Fremont Street Experience Group. They informed us that they've been very proactive, so to speak, in getting their employees over to the Cashman site because it's so close to their operational area downtown, and that they didn't have any additional needs at this time. They were going to continue to utilize the public pods and so forth. So we made a lot of progress there. And Mike, I'm sorry, I forgot the second part of your question.
1 second, let me unlock him again or unmute him. Here we go.
Sure.
Go ahead, Michael.
Yes, thank you. Sorry, very quick follow-up to what you just told us. For those companies, for example, Caesars, Red Rock, Sands, are those going to be similar to MGM where it's any employee from that company, not just at that one specific property, could come and get vaccinated there? And then my other question that I initially asked was, at the mass vaccination sites, Cashman, for example, are we going to see expansion of hours later into the evening there?
When we get some vendors on board, we're looking at different operational timeframes for that to get into the later hours. We're also talking about a couple other concepts of smaller after-hours sites, maybe one here at the Health District, maybe one in some other locations where we would staff with some private vendors to provide vaccines up till like 8 or 9 o'clock at night. So still a work in progress. A bulk of our work this last 2 weeks has been to focus on the hospitality group in conjunction with the Gaming Control Board and all the hospitality providers, and then getting our mobility branch of our organizational chart built out to reach out to homebound people and do some outreach with, as Joanne mentioned, different church groups and work groups to stimulate some activity.
And I believe some of the providers that are providing vaccine for the hospitality groups are also doing alternative hours too.
At this time, we're going to take one more question for the English language portion of this, and then we'll move on to the Spanish. So this next question comes to us from mhynes.
Thank you and good afternoon. So with additional casinos offering vaccine on site, how do you plan to divvy up the vaccine allocation then between the public sites, which you've said are going to be very, very busy next week, and this effort to get the hospitality workers vaccinated? For instance, you had said that half the vaccine allotment for public events would go toward the hospitality effort, but what is that division looking like now?
Well, the state immunization program has set aside a certain vaccine for that group, and we are seeing larger amounts coming to Nevada. Not necessarily to us, but maybe to some of the providers that will be working with the hospitality industry. So we are allotted so much. Our public sites are allotted so much, and then we focus on our outreach as well. So far we've been able to fulfill most of that capacity. But, until we find out from the state what next week looks like, we're not sure, we're ready to go next week with full capacity, but we're still waiting on our vaccine allotment.
Thank you. Also joining us on the call today, we have Clark County Commission Chairwoman Marilyn Kirkpatrick joining us by phone. I'm going to unmute you if you would like to make any comments, Commissioner.
Thank you. No, I just wanted to really thank all of the team that's been working many hours to try and ensure that the public has accessibility to vaccines, and I think that we are seeing that, and thank the public for doing their part, getting out and getting their vaccine. So I look forward to being able to open it to everyone next week and to work through that process.
Thank you so much. Thank you for joining us today. At this time, we're wrapping up the English language portion. Before we move on to the Spanish, does anyone on our panel have anything else to add?
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.